Geingos and a panel of experts dissected this during a side event of the Summit of the Future at the UN headquarters on Friday. They expanded on global, regional, and country-level actions which are critical to advance the rights of young people and ensure a sustainable future for all. Geingos shared the success of collaboration demonstrated through establishment of #BeFreeCampus, whose services are inclusive of sexual and reproductive health and rights programs.
And SIHR is one of the areas where you have to spend social and political capital. It's not a popular area. It really is a site of contestation of what SIHR is and what it isn't, particularly of late. What we know it is an incredible enabler of what is good of a demographic dividend. Unharnessed, it's an incredible risk to what the demographic dividend represents, particularly to continents like the African continent. And that's how we went about utilizing social capital to build effectively what young people told us they wanted built. It was really a listening tour that we did throughout the country, with a couple of African countries as well as we even had one here in Harlem, and I think we did something similar in Amsterdam. And to listen to young people, if money wasn't a problem, what would you, if you had to put a physical manifestation of all your desires in one place, how would that look like? And the answer is what we ended up building as the Be Free Youth Campus.
Another initiative that I want to share is the Adolescent and Youth-Friendly Clinic. As a ministry, we do have these clinics in 8 regions in the country. And when you read the UN Youth Strategy 2030, the second priority of that strategy speaks to accessible quality education and health. So for us as a ministry, this is how we are really trying to meet this priority number 2 of the UN Youth Strategy, to ensure that the young people are able to access these health services in a, again, non-judgmental space.
For young Namibians, SRHR is a topic we shy away from because it's often seen as a taboo. It's often seen as a topic we can't discuss in rooms because of how sensitive it is. But I'm glad to also be standing here and to speaking on an issue of SRHR because of the commitment that one of the wonderful panelists has done to ensure that SRHR in Namibia doesn't become a taboo anymore.
The UNFPA says the cost of impact of inaction on sexual and reproductive health and rights runs into trillions of US dollars.
Very important to say that the cost of inaction is estimated at $110 trillion over the next 27 years. So yes, mental health, yes, nutrition, and employment. This is something that time and again UNFPA has heard young people say. I will close by quoting to you what young people in the Cotonou Agenda put on the table in April in the country of Benin, where UNFPA, as part of the summits that we've had celebrating ICPD 30, convened a meeting for 500 young people from all around the world. And guess how many applied? Over 14,000. Hence our need to do a hybrid platform, because here you have 14,000 young people who actually know what sexual and reproductive health and rights what the meaning of that is in their community, in their village, in their city.
And our contribution was, creating relevance among young people for HIV. So we introduced the topic to the whole field of sexual health and comprehensive sexual health education at a time where it was not en vogue, and many people were criticizing us for that. So we were running very big campaigns, and we figured out that it was about the right language to reach young people. It was about having big dreams and thinking of, okay, one day we will be at the United Nations talking about youth empowerment around sexual and reproductive health. And it was about finding the right partners.
The side event was organized in collaboration with Namibia's government, UNFPA Namibia, and One Economy Foundation.